Piperacillin Tazobactam, a good combination to deal with loss of bacteria. But before delving deeper into this topic, let me welcome you to my channel. Thanks for visiting. Thanks for remembering to subscribe if you haven't. But if you subscribe and you're visiting again, I appreciate that. Please share this with everyone. Piperacillin Tazobactam is a good combination in antimicrobial world. Now, Piperacillin Tazobactam is considered to be safe and well tolerated by many people. I'm not saying it is going to be like that for every human being, but for many, it's a good combination. It could come under different brand names depending on the one available in your jurisdiction, so you can find these as the brand names. As per the class, of course, it is an antibiotic. Remember, two medications are involved. The piperacillin here is a penicillin, while the tazobactam is a beta-lactamase inhibitor. Mechanism of action. Piperacillin inhibits bacterial cell wall synthesis, and they do that by binding to a penicillin binding proteins, thereby inhibiting cell wall biosynthesis. Autolytic enzymes will break down the bacteria through autolysins and marine hydrolysis. The tazobactam will inhibit many bacterial lactamases, including Staphylococcus penicillinase, but there will be less activity against class 1 beta-lactamases other than class 1C types. Now, the uses. Useful against beta-lactamase producing organisms, for example, E. coli, Klebsiella pneumoniae, Salmonella, Proteus mirabilis, Pseudomonas aeruginosa, Bacteroides, that is gram-negative obligate anaerobes, Shigella, Serratia, and the list goes on. Still on uses, also helpful in the face of bacteremia, polymicrobial infections, sepsis, burns, diabetic foot infection, cholangitis, diverticulitis, abscesses, perforated appendicitis, peritonitis. Also in cystic fibrosis, endometritis, pelvic inflammatory disease, neutropenic fever, necrotizing colitis, and malignant external otitis. Other uses will include urinary tract infection, in endocarditis treatment, in prophylaxis against polymicrobial organisms, for example, in surgery, and of course, community-acquired pneumonia or hospital-acquired pneumonia, and also in cholecystitis. Dosage forms. Piperacillin sodium to tazobactam sodium ratio will be at 8:1, respectively, meaning the ratio of piperacillin sodium will be 8:1 of tazobactam sodium. We'll see in a bit. Under the forms, I will first of all consider the premixed infusion in isoosmotic solution. The isoosmotic solution means they have similar osmotic pressure. Here, we're going to find generic under 2.25 gram or generic 3.375 gram or generic 4.5 gram. Don't worry, I'll break it down in a bit. Here, the brand name Sozin, that is the premixed infusion in osmotic solution, we can find zosine, not only generic, as 2.25 gram. In that case, piperacillin will be 2 gram, while tazobactam will be 0.25 gram in 50 ml. Remember, that is ratio 8:1. Also, 3.375 gram means piperacillin 3 gram, tazobactam 0.375 gram, or 375 milligram in 50 ml. Also coming down to ratio 8:1. Also in zosine 4.5 gram, piperacillin will be 4 gram, while tazobactam will be 0.5 gram. Also coming down to 8:1 as per ratio in 100 ml. So that will be all about the premixed infusion in osmotic solution. Now, another form will be injection powder for reconstitution, and that will be the second form. In that case, it's going to be generic only, meaning generic only will be found as injection powder for reconstitution, and the dosage strength could be 2.25 gram, meaning piperacillin will be 2 gram, while tazobactam will be 250 milligram. It could come as 3.375 gram, meaning piperacillin will be 3 gram, while tazobactam will be 375 milligram. Could be 4.5 gram, with piperacillin as 4 gram, while tazobactam will be 500 milligram. It could be 13.5 gram. In that case, piperacillin will be 12 grams, while tazobactam will be 1.5 gram. And it may be 40.5 gram. Then we will have piperacillin as 36 gram, while tazobactam will be 4.5 gram. So different dosage strengths. Then we'll break it down to the constituent piperacillin and tazobactam. The third form will be injection powder for reconstitution, but without preservative, meaning preservative-free. In that case, we can find two brands, the generic and zosine, at 2.25 gram, 3.375 gram, and 4.5 gram. The zosine can have, in addition to this, can have 13.5 and 40.5 gram. Administration. Piperacillin tazobactam can be given intravenously by infusion for at least 30 minutes, and you can give that every 6 hours. Or you go for the extended infusion intravenously with the loading dose 4.5 gram, and you give that 3 to 4 hours, and then you repeat every 6 hours. It might be in form of continuous infusion intravenously, where you can give up to 18 gram over 24 hours. Still on administration, if you are considering wide-side compatibility, sure, why not? You can, but let's take note of this. It's not all medication that could be given along with piperacillin tazobactam. It would be good if you have reformulated zosine containing EDTA. Okay, that will be compatible with amikacin or gentamicin. Remember, they're both aminoglycosides, right? Only if the aminoglycoside is already diluted with normal saline or D5 water. Let me explain. You have your IV line already in situ, right? And you are running your piperacillin tazobactam. So if you are thinking of one side other medication that could be given through a pod, then it should be that you have zosine up there containing EDTA. In that case, if aminoglycoside is the other drug you want to give concomitantly, then you can run amikacin or gentamicin. But that amikacin or gentamicin must have been diluted with normal saline or D5 water. But we will not give tobramycin in that way. No, tobramycin is not compatible with white sites when you are using piperacillin Tazobactam. Though is also an aminoglycoside. If the body mass index of the individual to take this medication is greater than 50 kg per meter square, you can give as high as 4.5 gram over 3 hours in every 6 hours. If the individual is critically ill, but with augmented renal function, for example, creatinine clearance already estimated is greater than 100 ml per minute, then you can give 4.5 gram over 4 hours, and you can do that every 8 hours. Still on administration, someone is already getting tired that we're talking so much about administration. Yes, of course, that's pretty important. We should know when and how to administer this medication. In kidney pathology, we cannot just administer this medication. We have to be very careful. We are going to adjust it appropriately. We'll go for the creatinine clearance. If it is less than 20 ml per minute, we have to use a lower dose, like 2.25 gram every 8 hours. But if the creatinine clearance is above this level, if it's something between 40 and 100 ml per minute, then you can increase the dose to 3.375 gram every 6 hours. If the creatinine clearance is high, greater than 100 ml per minute, or up to 130 ml per minute, you can even use extended infusion. Okay? If the creatinine clearance is between 130 to 170 ml per minute, you can use the loading dose of 4.5 gram and then have daily total infusion up to 18 grams in 24 hours. You can see the difference. Somebody can now go more than 2.25 gram every 8 hours, while someone else can have as high as 18 grams in 24 hours. Now, if creatinine clearance is just high, close to normal, greater than 170 ml per minute, you can have the loading dose of 4.5 gram and daily infusion up to 22.5 gram in 24 hours. You could see the difference. Someone could go as high as 22.5 gram in 24 hours, while someone cannot go more than 2.25 grams every 8 hours. Contraindications. We will not give this medication if there is hypersensitivity to penicillin or cephalosporins, or hypersensitivity to beta-lactamase inhibitors or any component of its formulation. Drug-drug interactions. Please contact your pharmacist and clinical pharmacologist, because I may not be able to say precisely which medications you will be taking now or close to the time that you are going to take this. So the list is pretty long. I'm going to leave that to your pharmacist and clinical pharmacologist in your jurisdiction. Now, monitoring. Someone is already on Piperacillin Tazobactam. We need to monitor the vital signs. What is the blood pressure? What is the heart rate, respiratory rate, the temperature? Then we want to check out for any allergic reaction right now. So any anaphylaxis or hypersensitivity that is ongoing, we want to make sure that is not occurring. If not, we got to stop the medication right away. Complete blood count. Are we running into anemia already because there is likelihood of bleeding? Then what is the value of the platelet? because the platelet is going to suffer here. Then are we running into agranulocytosis already? We want to have the complete picture of what is happening as per white blood cell count, the platelets, and the red blood cells. Renal function test, of course, we've just gone through the slide where we were determining the dosage based on creatinine clearance level. So we want to be sure that the kidney is effective, there's no impairment. Then liver function test, good liver will help us a lot. Then PT or INR, and then APTT, because we want to be sure we're not dealing with bleeding dyscrasia, because part of the adverse reactions will be bleeding on its own. Then urinalysis and glucose. Although the parameter from urinalysis is not the determinant of whether there's true hyperglycemic condition or not, because there may be glycosuria, which is not necessarily saying the individual is having diabetes or not, because of transport maximum of the kidney that could be exceeded. But there are so many other parameters that we could get through the urinalysis. Also here, we will do, when we have renal function test and we are okay with the electrolyte, with blood urea nitrogen and creatinine and everything, then we'll be able to continue with the dosage, reduce it, or even increase it based on the set goals that we're already achieving or not. Now, adverse reactions. When a medication is pretty good, like Piperacillin, Tazobactam, and it's helping a lot, then we should be on the lookout for the unwanted effects or unwanted reactions that the individual taking this medication may be subjected to. So with that, let's go. Now, the adverse reactions. DIITP simply means drug-induced immune thrombocytopenia. So there will be drop in platelet level, leading to bleeding, epistasis, ecchymosis, petechiae, frank bleeding, or intracranial hemorrhage. Pretty serious, right? Okay. We can also run to C. diff, that is Clostridioides difficile, formerly known as Clostridium difficile. So that can occur, and that is a form of infection, right? And the symptoms here will be diarrhea, abdominal pain, fever. They can have nausea, anorexia, malaise. In fact, they can have toxic megacolon, and they may have sepsis or even colitis. Then from this medication, this good medication, there may be bone marrow suppression. If that is the case, there may be pancytopenia. When there's pancytopenia, we'll be dealing with anemia, dealing with neutropenia, and of course the cascade of events that will follow that. Then agranulocytosis, that is pretty bad. There may be immediate hypersensitivity. In the case of immediate hypersensitivity, there may be anaphylaxis shock, hypotension, urticaria or rashes, angioedema or flushing, bronchospasm, and so on. Still on adverse reactions, there may be delayed hypersensitivity, in which case the individual can come down with toxic abdominal necrolysis, Stevens-Johnson syndrome, drug rash with eosinophilia and systemic symptoms, that is DRESS. There may be neurotoxicity, which means piperacillin-induced encephalopathy. In that case, the individual could become confused with changes in behavior. There may be dysarthria, tremor, slurred speech, hallucinations, and seizures. Nephrotoxicity is a possibility, and we cannot overemphasize the importance of having renal function test before this patient will start using this medication. So please, once again, have that renal function test done. And it's going to be horrible if someone with impaired renal function will be on this medication at high dosage, and then at the same time, at wide size, you are administering vancomycin. Then the damage to the kidney will be worse. There may be hypo or hyperglycemia. Remember, while talking about monitoring, I have said we will do analysis and then also estimate plasma glucose level. Other adverse reactions that may follow will be secondary fungal infection like candidiasis. There may be insomnia, so it's noteworthy that will let the affected person that will be taking this medication know that your sleep pattern may be altered. And the headache, but we should be sure that we've done everything, that the headache is not as a result of intracranial hemorrhage. And the rigors, and of course, acute renal failure. Once again, for the fourth time, I'm going to talk about renal system as being important while administering this medication. So someone with impaired renal system on this medication can have double trouble, right? Because this medication on its own can shut down the renal system, giving us acute renal failure on top of impaired renal function, then it's going to be a serious problem. Now, still on adverse reactions, some electrolytes will be affected and it will go down the hill, the downward trend. Potassium will drop, hypokalemia. Sodium will drop, hyponatremia. And calcium level will drop, hypocalcemia. And with this, there may be prolonged QT. When that happens, then the arrhythmia, the cardiac electrical activity will be in trouble. There'll be cardiac arrhythmia. One, we've just finished on the slide involving the electrolyte. Now, we want to start by telling ourselves or reminding ourselves that there will be electrolyte anomalies. Potassium withdrawal, sodium withdrawal, calcium withdrawal. Each of these is a big problem. Each. Hypokalemia is a big problem. Hyponatremia is a big headache. And hypocalcemia is not what we are not asking for. So we should be careful. Watch out. Renal function tests be done. Electrolytes be assayed. Fungal superinfection, we've seen candidiasis, right? It could lead to acute renal failure. Remember, for the fifth time, I'm talking about renal function. So if you can't take anything home by clicking on this very topic in my channel, now take this home that kidney must be assessed before taking this medication. And while on this medication, renal function test must be done. Remember Clostridium difficile infection possibility, right? Remember, if this is not taken into account, there may be toxic megacolon, maybe perforation and death from helping someone. While using or adding other medications, consider the medications with the probability of nephrotoxicity or neurotoxicity, or those other medications that are capable of leading to bleeding, because we cannot afford to add other medications that will lead to any of this, because Piperacillin Tazobactam combination is a pretty safe and well-tolerated medication, but it's not devoid of its own side effects or adverse reactions. Just few examples of when and where we can use piperacillin tazobactam. Mostly, many patients will be placed on 3.375 gram intravenously every 6 hours. Okay, and we're going to run this for minimum of 30 minutes. But I will not forget to remind you, renal function tests must be done. If there is a level of renal impairment and creatinine clearance is less than 20 mL per minute, we cannot give this dosage. We have to bring the dosage down to 2 point something gram, okay? In severe infection, you can give as high as 4.5 gram intravenously every 6 to 8 hours. But that is when you have determined that the kidney is good enough to handle that. In Pseudomonas aeruginosa, you can go as high as 4.5 gram every 6 hours with the maximum of 18 gram in 24 hours as the maximum dose. In sepsis, you can give Zolzine 3.375 gram to 4.5 gram over 30 minutes. That is as the loading dose for a rapid therapeutic goal. Then you can keep the dose of 3.375 gram or 4.5 gram over 4 hours every 8 hours. So you can do that. You can also have continuous infusion like Zolzine 18 gram intravenously infused over 24 hours, but with a loading dose of 4.5 gram over 30 minutes for rapid therapeutic change. You can have extended continuous infusion from 48 hours to 14 days. But you can even go longer, as long as up to 3 weeks, depending on what you are targeting. But if you are confused, please call the pharmacist or clinical pharmacologist to help you out. Finally, procalcitonin could be acid even before beginning the administration of these good antibiotics. Okay? There's a separate presentation on procalcitonin already published by me, and here is the link. When you click on this, that will take you to full presentation on procalcitonin. There you know the importance of procalcitonin when it comes to shedding light on the confusion. If you're not sure, this is a viral condition or bacterial infection. And then when the individual is already on the treatment of a bacterial infection on antibiotics, right? Then you'll be able to make the determination whether we're winning or we're not winning based on procalcitonin level. Okay, let me leave that alone. You can click on this, and then you get all the pieces of info. Also, the severity of illness will determine the dosage of piperacillin tazobactam that we want to use. But that is not the only factor. We must be sure that as far as renal system and liver is concerned, the patient is good to go. Other antibiotics that could be used concomitantly must be put under check for neurotoxicity or nephrotoxicity or bleeding tendencies. And of course, we must rule out bleeding disorders and hypersensitivity before jamming that man or woman with this medication. Lastly, I've been hammering the point on renal system. If the creatinine clearance is less than 20 mL per minute, we cannot give high dose to this patient. We will go for the lowest dose possible. With that, I've come to the end of this presentation on the good antibiotic combination known as piperacillin tazobactam. I'm not an agent of any pharmaceutical company manufacturing any brand of this medication, but as a physician, I'm just sending out the useful pieces of information to the entire world. that these antibiotics is helpful, but you must be careful so that while trying to help will not cause more harms. Thanks for listening. Remember to share this. Remember to subscribe to my channel. I appreciate it.